More than 20 child leukemia patients have died in the hospital in Sana'a due to taking contaminated drug. Source cast the entire responsibility on the Houthi Ministry of Health, which has allowed to use this drug. This report has more on this.
At least 20 children with leukemia died in Yemen after receiving expired doses of a cancer treatment in the rebel-held capital Sana'a, according to medical officials and staff. The children were among 19 patients aged 3 to 15 who died at Sana'a's Kuwait hospital after being injected with smuggled medicine at a number of private clinics. According to a half-dozen health officials and workers who spoke to the Associated Press, about 50 children received the chemotherapy treatment, which was originally manufactured in India. One of the children's families said their son experienced pains and cramps after receiving chemotherapy and died 5 days later. The boy's father added that the worst part, the hospital's administration, which tried to keep the truth from the family. The conflict in Yemen that started in 2014 has cut off access to necessary items such as food and medicine. The ongoing war in Yemen has also resulted in the closure of many clinics due to lack of staff, medicine, and equipment, forcing people to travel many miles to get the needed treatment. In addition, Houthis are frequently accused of obstructing or delaying humanitarian aid deliveries, on which 80% of Yemen's 30 million people rely for survival. Also, several doctors in Sana'a said that the Houthi officials secretly work together with medicine smugglers who sell expired medication to private clinics from storage facilities across the country. In Yemen, 19.7 million people do not have access to basic health care. Only 51% of Yemen's health facilities are fully operational, and the majority of those lack specialists, equipment, and basic medicines. These gaps have an impact on services for the most vulnerable, particularly women and children.
Coming next.